My name is Joni, and I am 36 weeks pregnant and 2 days. So I am getting there. This is baby number 2. We are having a boy. I have a 2-year-old daughter right now. So yeah, I'm going to kind of go through my hospital bag / birth center bag and show you what I packed. So my last labor and delivery, I was at a birth center, and I ended up getting transferred, and then we stayed 2 nights in the hospital. So with this one, I am anticipating staying at the birthing center, hopefully, but I'm also leaving my expectations kind of open and not really having a set plan, because I do know that things can change last minute. So this is my hospital / birth center bag. So I'll go through little baby stuff first. So I just have this bag. It's just, there's no pockets or anything. Just a plain bag to kind of throw his stuff in. But I'm packing a couple outfits. My daughter was 8 pounds 9 ounces, and I feel like he is going to be a little bigger. Just have a feeling, who knows. So I packed 2 outfits. One is newborn and one is, I think, 0 to 3. I packed him these little like jogger pants that are just, they're newborn, but they just seem so tiny. And then I just have these Gerber little shirts that snap on the side. They don't really want us to bring any onesies or anything like tight that goes over his belly, because the umbilical cord is still going to be there and we don't want to irritate it. So at least this, we can look at it and have easy access to it and kind of maybe leave it out a little bit so it can dry. And I just brought an extra one because who knows. With that, I got this cute hat off of Etsy that says his name, Ozzy. Seems sort of big, so I don't know if it's going to fit him, but I do want this for pictures. And then if it's too big, then I have this other one that is just tiny. I know they'll give us a hat at the birthing center, but I do want a couple options. And then I have, if that's too small, the pants or anything, I have this just gown that my daughter wore a lot, and it was just super easy. I like that it just can open and easy access to the diaper. It's not gonna like be really tight on the umbilical cord. And then it has the non-scratch little flaps right there. So a couple outfits. If all goes according to plan and we deliver at the birthing center, then we will only be there after birth for like 4 hours, 4 to 6 hours. So we don't need a whole lot because we'll be going home soon after that. I brought him 1 pair of socks and little mittens in case his nails are really sharp and he's scratching his face. We don't want that. I also brought a burp cloth, something like this. Just if I'm breastfeeding or burping him or whatever, I just put it over my shoulder. And I also brought this same thing. I brought a couple muslin blankets to swaddle him in. This one has like forest animals and trees, which I love. And then I have this one, which I really want to swaddle him in and take pictures in because he is our rainbow baby boy. And then they do have diapers there, but I just brought 4 newborn diapers for him as well. So moving on to my bag. If I'm not comfortable in what I'm wearing while I'm in labor, or if I even care in the moment, which like I probably won't. But here is an option to labor in. I just have these real comfy pants. If I'm in like, I don't know, underwear and no bra, or like, I don't know, shorts or whatever, then I can just change into this and we can leave. I do have just a really comfy sports bra that would be nice to labor in. And then a gray tank top exactly like the one that I'm wearing right now. So if I'm not comfortable in what I'm wearing before we leave, I can just throw that on and grab my bag at the same time and kind of head out from there. On top of my bag, I have these little baggies, which I thought were perfect because they're see-through, and maybe I'm not going to be the one searching for things in my bag, and it'll just be easy for my doula or my husband to just, like, if I need chapstick and I need it now, you know, he can look and be like, oh, chapstick is in here because I can see it. The small bag I have just some lotion. I am obsessed with lotion. In labor, if I happen to go in the bathtub for a little bit and I come out and I just have that feeling of like the dry, itchy, whatever, then I can just tell my husband or my doula, get the lotion, rub it on my legs, please. So I have lotion, and then postpartum, if I want some lotion. I have face oil for postpartum when I want to wash my face after all that craziness. Another face oil with frankincense and lavender to just like soothe my skin. Last time I was just very swollen everywhere, so I think I'll really want to refresh, especially after like sweating and just going through labor. I don't know how long it's going to be. Just wash my face and put on some nice face oils so I feel nice and refreshed. And then I have some chapstick. In this bag I have a toothbrush, toothpaste, a comb, and a hair tie, and a scrunchie, and some clips. Afterwards, I can brush my teeth and, you know, fix myself up a little bit. And in this bag I have a couple pairs of underwear. They're just my maternity underwear, so they'll be comfy postpartum too. And then I have a couple sports bras because I'm gonna probably go in and out of the bath a couple of times, and I'll wear a sports bra into the bath. So when I get out, I don't want to be wet and cold. So I just have some options. This is just a really comfy, stretchy sports bra from Target I got like 3 years ago. And then I have this one that is cute, but also really comfortable. This will probably be what I wear in the tub. So then if I have any pictures, I think that this is cute. Not that it matters at all, but right now seems like why not. And then this can be a dry sports bra for out of the bathtub. And then I'll go into the birthing center wearing a sports bra. So I'll have that one too. So lots of options. I do have this rice bag that I'll probably use at home while I'm laboring, so hopefully I remember to throw it in the bag before we leave. This will be really nice. I used it a lot when I was in labor with my daughter. And you just throw it in the microwave for a minute, or a minute and a half probably. And I really liked it down here when I was like laying and having contractions, or like around my back. And it has these handles, which are really nice, so you can like put pressure on it. So it kind of stays and the heat is going directly where you want it to. If you're laying, like kind of like that. So as far as clothing and such, I do have, I think like 8 pairs of Depends, just because I doula, and I doula at this birthing center, and I feel like women always bring like 2 pairs of Depends, and sometimes they need more, and postpartum, who knows what's going to be just gushing out. TMI, but you never know. I wore these a lot, not really in labor with my daughter, because my water didn't break until the very end, so I didn't really need them, but postpartum, for sure. They're just, a pad is annoying to like stick to your underwear, and I just feel like there's room for leakage, and these are just like, oh, you put them on and I feel like it's nice and secure. Everything is like in there. And then I brought a robe. I didn't like go out and get anything fancy. I just have had this robe for a long time. It's just a blue cotton, not too thin, but not too warm, because we are in Florida and those hormones can make your body real hot. So I have this for if I'm cold, or when I get out of the bath, I'll just throw that on and be comfy, and I can just take it off if I'm too hot and all that stuff. I have this gown for, I don't know, if I'm uncomfortable in the pants or after the bath, if I want to put on something different. I also have this jacket for if my robe gets wet or like gets dirty, anything gets on it. I have this jacket for in labor or after. If I'm cold, it's like blanket material. It's like an extra large, and I got this a long time ago from Target. But just super comfy, and something that I think that I'll use. I did bring one nursing bra. I don't think that I need two, because I'm only going to be there for 4 to 6 hours, and if I'm in the hospital, I will just wear this the whole time, or go braless. I don't care. So this is from Amazon, and I really like it. It's nice and comfy. Then I have these pants that I got from, where did I get these? Old Navy or Forever 21. I can't remember. They're just nice, high-waisted. I think they'll be comfy for postpartum. They're thin and soft. They go all the way down to my ankles. I have this nursing tank, but it might be cold. So sometimes Florida, we don't see a cold front until like December or January. I'm due November 22nd, so it could be cold or it could be hot and humid. So I have that tank top for going home, and then I also have this quarter sleeve little black shirt that has buttons that go down far enough to nurse in, comfy and loose. It's not going to be like tight on my belly or anything like that. And I just got this from Target, and I really like it. It's soft. So I have that as another option with those pants. And then I have this. It's just like a nightgown that zips all the way down and is really soft. And I wore this with my daughter also. I actually wore it from the birthing center when we transferred. I had this on, and it kind of worked as a hospital gown. They didn't put me in a hospital gown because I had this on, and it was just very easy until I puked all over it. Then they changed me out of it, and I put on a hospital gown because it was like yellow bile. I am going to be using these affirmation cards. I've been using them already, kind of every day I pick 2 or 3, and I just kind of focus on the message and kind of meditate on it and just look at them because they're so pretty. So this is pregnancy and birthing. So I've separated the pregnancy ones, those are downstairs. These are all about labor and birth. So I'm hoping to, I probably won't use them in like transition, but early active labor, I think these are going to be a really great resource to kind of refocus my energy and just like have a visual to look at during a contraction. I remember when I was laboring at home with my daughter, I had this like flower pillowcase that I remember kind of laying on over the toilet, and during a contraction I would just stare at it and like look at all the patterns, and it really helped. It didn't help for very long, but maybe like 30 minutes to an hour. It was like my routine. For water, I am going to bring this big guy. It is 32 ounces, and it has a straw in it. So if I'm laying down, I can just kind of drink it whatever angle I want. And it holds a lot of water. So this will be probably my water one. And then I have another water bottle that I'll put another drink in, maybe coconut water, or I got these body armors. Definitely for after birth, I'm gonna like down one of these so that I'm replenishing everything that I've kind of lost, and getting electrolytes and sugars and all that good stuff just immediately afterwards, especially in case I lose more blood than usual. I have this in my system. I think these will be good also in labor if I want something sweet other than coconut water that also is going to hydrate me really fast and really well. I love those. I just got these Kind bars. They're dark chocolate mocha almond. Gonna bring a couple of these, and then I don't have anything else packed, but I'll probably bring like some fruit and some crackers, just like small little things to munch on while I'm there. If I think about it, if I can even smell food and be okay with it, then I'll have those. And also if my husband gets hungry, it's something quick that he can just like snack on. The birthing center does have essential oils already. I do have clary sage, peppermint, and lavender here at home that I will be rubbing my feet, all the acupressure points with, and smelling and diffusing and all that good stuff. And then I'll just leave them here because they have all of that at the birthing center that they will probably already have diffusing when I get there. But if not, we can ask for it, and that's something that they can do. Things I still need to pack are like chargers for the camera. I'm probably going to bring the GoPro and just kind of set it up somewhere and try and record the whole thing. I do really want to capture as much as possible because with my daughter, I have like 5 pictures, which are wonderful, and I'm so happy my mom got them because we didn't even ask her to. She just kind of snapped them, and they're beautiful. But I want to like go back and look at more stuff about her birth, but I just don't have it. So that's why this birth I want to video or take pictures, just kind of document as much as I can so that one day I can go back and kind of relive it and look at all the pictures and see how we did. I might bring a big blanket, but I know that the birthing center has big, soft, comfy blankets, and with my daughter in the hospital, we just used their blankets, and I didn't care. Their pillows were comfortable, their blankets were fine. Like, I'm really not picky, so I think that might be just too much. I think I'll leave the blanket at home. And then my husband is going to pack his backpack this week, so we will have this bag, baby's bag, and then my husband's backpack, and that'll be it. So we're not going to be bringing a whole lot into the birthing center, because it's just kind of overkill. You don't need that much stuff. I was going to bring like nipple pads and some other stuff for breastfeeding, like nipple butter and stuff, but I don't think I'll need that being there for 4 hours or 6 hours. Or even in the hospital, I didn't need that because my milk didn't even come in until I went home. So, yeah, I'm just going to leave that. And if I really need it, then they probably have something that I can use. That is my hospital bag for baby number 2. We have 1 month left if we go all the way to 40 weeks, which with my daughter, I was 6 days late, so I'm probably going to make it to my due date. So about a month to go, and this is making me feel a lot better having all of this organized and done, so I don't have to think about it, and it's just another thing checked off my list. So thank you for watching, and I hope that it helped you.